All right, let's get started. First thing with ABGs. This is our body, right? Our body loves to do one thing, and our body loves balance. Without balance, things does not work. And ABGs now comes into play. So when we talk about ABGs, this is either the body is acidic, either it is neutral, or it is too alkalotic. Okay? Now, one thing about ABGs is that it doesn't like to be acidic. Okay? It doesn't like to be alkalotic. It wants to be neutral at all times. It wants to be within the normal range. And that normal range is 7.35 to 7.45. This is the range that it loves to be at. That's what I call neutral, right? It doesn't want to be too low. It doesn't want to be too high. When it's too low, things get complicated. When it's too high, things get complicated. Are you with me? Great. So once the body is between 7.35 to 7.45 in terms of ABGs, it's perfect. It's working so well. Okay, so now that you know this, let me show you what maintains this balance. Two mechanisms will maintain this balance. Your lungs, that's number one, and your kidneys. Okay, so these two guys are like the soldiers who maintain the pH in the body. So the kidneys has its job, the lungs have its job. Are we okay? Now, when you think about the lungs, think about CO2, carbon dioxide. Okay, so it uses CO2 to regulate the normal range, the pH level. Okay, and then with the kidneys, it regulates HCO₃, and that is bicarb. So anytime you see CO2, we're talking about the lungs, and anytime you see HCO₃ or bicarb, you're talking about the kidneys. I hope you're okay so far. Great. Now, let me show you the normal ranges as well. All right? So CO2, again, anytime I say CO2, that's the lungs. It's between 35 to 45. Okay. And when I say HCO₃, I'm talking about the kidneys, and this is between 22 to 26. Great. Now, another word for CO2 is also respiratory, obviously. It's the lungs, right? And then when I mention HCO₃, or you're thinking about the kidneys, another word we can use here is metabolic. So when you see respiratory is the same as we're talking about the CO2, and that's the lungs. If you see metabolic, we're talking about the kidneys, and that is bicarb. This is the normal range for bicarb. This is the normal range for CO2, and this is the normal range for pH. Perfect. I think we're okay so far. If not, go through this over and over again. Now, let me start with the CO2. Let me talk about this guy a bit. CO2. The range was what? Good. 35 to 45. Now, the higher the number, okay, the more acidic. Now, let me explain why. CO2 in its own state is acidic. So obviously, if you have too much of this guy in the body, it's going to be more what? Acidic. And when it is low, right, less than 35, then it's going to be what? Alkalotic. So remember this, or put this in your mind, that CO2 in itself is acidic. The more CO2 is being retained in the body, the more acidic the pH will become. All right. Now that you know this, let me also introduce you to bicarb so that you know that as well, HCO₃. Now, HCO₃ is 22 to 26. HCO₃ is not acidic. So the higher the number, okay, when it's more than 26, the blood or the pH becomes alkalotic. And the lower the number, okay, lower than 22, it's what? Acidic. We don't want this so much. Then the body becomes what? Acidic. So you realize that CO2 and bicarb is like in the opposite. Okay, it's like in the opposite direction. For example, the pH will be low if the CO2 is high. The pH will be high if the CO2 is low. And it's the opposite with metabolic, right? With metabolic, the CO2 is low when the bicarb is also low. Sorry, the pH is low when the bicarb is also low, and the pH is high when the bicarb is also high. Okay, so we can say that with respiratory, it's the opposite, and then with bicarb, it's equal. Okay, so respiratory, it's opposite, and the metabolic, it's what? Equal. Okay. All right, now that we're done with this, let's move on one step further. Now with ABGs, it's basically like you're trying to figure out what is causing the pH to be low or what is causing it to be high, right? So you are trying to like play a game, I like to call that, to figure out, is it carbon dioxide? Is it respiratory that's causing this issue, or is it bicarb that's causing this issue? Okay, so let's move on. Now, remember that I said that when it comes to respiratory, okay, so in this case, you're looking at the CO2, right? The more the CO2 is in the body or is retained inside, so as you can see here, let me just zoom up a bit. You can see that there's so many CO2, right, still inside. The more it's retained, the more acidic the pH will be, right? Because CO2 is an acid. So think about anything that causes CO2 to be trapped inside of the body. An example of this is COPD. Or when you are hypoventilating. Because when you are hypoventilating, you're not breathing fast enough, right? So you're retaining a lot of the CO2 inside of your body, which is making your pH more acidic. The opposite goes when it is alkalotic. Think about any type of condition that causes you to blow off a lot of the CO2. Here you're seeing that the lungs here is blowing off a lot of the CO2, right? So it causes low amount of CO2 inside of your body. An example here is when you are hyperventilating. So when you're hyperventilating, you will see that you are not going to retain a lot of the CO2. You're going to blow them off, okay? Now let's talk about metabolic. What are some conditions I will point you over to that this is a metabolic condition that is causing it to be acidic or alkalotic? Number one is DKA. Okay, DKA causes acidosis. So this is acidosis. All right, so that is showing that the bicarb is low, right? So things like diarrhea as well. Diarrhea. Okay, that is metabolic acidosis. Now, a cool way I like to remember diarrhea, diarrhea, acidosis is coming out of your acidosis. You get that? So that is how I try to remember that. And also this is alkalotic. So it's going to retain a lot of the bicarb inside your body. So an example here is diuretics. Okay, and then also when you are vomiting, why? Because the acid in your stomach is going to be coming out with your vomit. So remember that alkalotic, when you're vomiting, you do like alk to vomit. So that's alkalotic, and then acidosis, that's metabolic. Okay, great. Now let's solve some ABG questions. So there are two methods of doing this, and we're going to focus more on the tic-tac-toe method. This is how I like to set up my grid. There are different ways you can set up your grid, but this is just my way. And there is also the row method. The row method, I explained it. That was respiratory opposite, so ROME. So if you see that the pH is high and the CO2 is low, that's alkalosis. So it's going in the opposite direction when it's respiratory, and I explained that earlier. And with metabolic now, what happens is that it's going in the same direction. Okay, I like this method, but I don't really like it because when we talk about ABGs, it's not just knowing if it is metabolic acidosis or respiratory alkalosis, but we also go through something that we call compensation. And I want to touch on that just a bit before I move on. When we talk about compensation, okay, something that I like to say is when something is going wrong and one person is causing it, what is the other person doing? Okay, I like just stay with me here. All right, so there are three types of compensations. There is number one, uncompensated. Okay, number 2, we have partially compensated. Oopsie, let me hide that. Partially compensated. And the last one is fully compensated. Okay, so these are the 3 types of compensation. We have either it's not compensating, so that's uncompensated, partially, like something is trying, or fully compensated. All right, so let me try to break this down as simple as possible. Now, when we talk about uncompensated, all right, the first one is uncompensated. Think about it as compensated. Think about it as the other guy is not doing anything. So let's just use this example, right? Let's say the pH is low. And once the pH is low, we know that it's acidic, right? And then let's say the CO2 is high. All right. So we can say that, okay, this is respiratory acidosis. Okay, I will show you everything. Then you ask yourself, okay, what is the other person doing? Is the other person trying to compensate or trying to do something? And when I say the other guy, I'm talking about this guy right now in this scenario. Okay, so when it's uncompensated, the pH in one of them is abnormal, but the other person is normal. Like they're not trying to do anything to fix the problem because we need 2 of them to tango, right? So that's uncompensated. And I will show this again in case you're getting confused, okay? So don't worry about that. And the second one is, let's go, partial. Now with this one, the other guy is trying to do something. So it will not be normal. All the 3, that's pH, CO2, and HCO₃, will be out of range. Okay? And last but not least, the last one was what? Fully compensated. Now with fully compensated, it's so easy to find because with fully compensated, the pH is normal. Okay. Let's get examples going so that we can help know how to manage compensation, okay? So let's just go straight to an example so that we will be able to understand compensation. First, you need to know the normal ranges in your head, so you know that. Let me just put it on the screen so that you will know. So 7.35 to 7.45, this is the pH. What I like to do is I like to interchange the CO2 so that it's all in the same place, right? So I like to put less than 4.5 on this side to, more than 45 on this side, and then less than 35 on this side for CO2. It just makes it easy for me to know. And then I bring it back to the normal, that is 22 to 26. And we know that is for HCO₃. All right, so let's plot on our grid. Now the grid has different sections. You can see the top side says acidic, neutral, alkalotic, and on the left hand side we have pH, PaCO₂, that is CO2, and then the bicarb on that side, okay? All right, so once you have set up your grid, it's easy for us to plot. This is called tic-tac-toe because you want to see who is causing the pH to be on the side that it is on. Okay, so here we have pH 7.31. Is 7.31 less than 7.35? Absolutely, so it's acidic. So now we know that whatever it is going to be acidosis. So I like to just do like this and say acidosis. The pH will tell you if it is acidic or alkalotic. Number 2, we like to look at the carbon dioxide. So in this case, it's 50. 50 is greater than 45, so it is acidic. So the question that you need to ask yourself right now is who is standing with pH? That's tic-tac-toe. 3 things are standing together, right? So it is respiratory. So respiratory is causing the issue. So if the question is not asking anything about compensation, you just got the answer, by the way. It is respiratory acidosis. But if it is asking for compensation, this is when we look at the other guy. In this case, the other guy is bicarb. Bicarb is 29. 29 is more than 26. So, is it uncompensated? Is it partially compensated or is it fully compensated? First thing, it is not fully compensated because the pH is not neutral. Okay, so that's out. Now, is it uncompensated? No, because if it is uncompensated, what you will see is that the bicarb would have been neutral. I like to say that the other guy is being lazy. The other guy is not trying to compensate or do anything. But the moment that the other guy is on the opposite side, it means that, you know that everything is acidic. So we need a base to make something neutral. Do you get that? Like we need it to pull it to the neutral state. So here we can say that it is partially compensated because it's trying, but the pH is still not yet at the neutral state. So we cannot say that it's fully compensated yet. So in this case, we say partially compensated respiratory acidosis, or you can write respiratory acidosis, partially compensated. Great. Let's move on to another example. Here's another example. We're going to talk about uncompensated. We know the values already. Write it down. Let's get cracking. 7.28, that is less than 7.35. We put that in the acidic. So now we know that the pH is acidosis. So whatever the answer will be acidosis, either metabolic or respiratory. 36. Is 36 in the normal range? Yes, because 36 is between 35 to 45, right? So that's neutral. So now we can see that no, it is not the respiratory that is causing the body to be acidic. It may just be the bicarb. So let's take a look. The bicarb is 17. That is less than 22. Exactly. Let's circle who is standing next to the pH. So now we can say metabolic acidosis. Let's look at the compensation. Is the carbon dioxide trying to do something to fix the problem? No, it's being lazy. It's just sitting there. It's not trying to pull. So because the CO2 is neutral, that is why we will say uncompensated. But if the CO2 was on this side, then we can say that, oh, it is partially what? Compensating. Get that? Great. Let's try fully compensated. Let's look at the acid. Oh, sorry. Let's look at the pH, right? 7.36. Ooh, that is normal. So the moment that you see that it is normal, so you can use the word normal or neutral, right? It's within the normal range. Then we can say, right, this points us to fully compensated. So I like to just put that there. I just like to take notes at the side. Fully compensated. All right. So let's look at the acid. Acid is 48. I mean the carbon dioxide, sorry about that. Carbon dioxide is 48. It's acidic, right? And the HCO₂ is 27. And 27 is also out of range. It's alkalotic. Now the issue that we face with fully compensated is this. They are all in the opposite direction. You tend to not know what to circle because they are all in different places. So here's a trick. When you look at the pH, 7.36, ask yourself, is this closer to the acid side or is it closer to the alkalosis side? 7.36, to be honest, is close to 7.35. It's going down to the acid side. However, let's just say that it was 7.43. I would say that, okay, this one is closer to the alkalosis side. So you create yourself an imaginary line and say that, all right, it's more closer to this side. And who is standing there? Respiratory. So we can say respiratory acidosis fully compensated. Yes, it is fully compensated. Yes, the pH is in the normal state, but we will say that, all right, it's closer to respiratory acidosis. Okay, all right. Now, by the way, this is just something that I realized. Some say normal for the neutral side. Okay, I just had neutral. Whatever you want to use, you just use that. All right, I hope you got that. So let's do 2 examples before we end today's class. Let's just do this one really quickly. Okay, so now you don't know which one we're going to do, so let's just do this. 7.48, okay, it's greater than 7.45, so that's alkalotic. 50, that is greater than 45, so that's acidic. 30, what is 30? 30 is greater than 26, who is standing there. Okay, so based on the pH, it was alkalosis. And what is causing the alkalosis? It is bicarb, and bicarb is also known as metabolic. And what type of compensation is happening? Correct. This is partially compensated. Why? The CO2 is also out of range on the opposite side. So this is partially compensated. Great. Let's do the last one. You can just pause this and do it on your own, and then we can review this together. 7.36. Did we do this one just now? Let me see. Okay, no. 7.36, normal. The moment that you see that it's normal or neutral, then we can say that this is what? Fully what? Compensated. Okay, great. Now 32, 35 to 45. So 32, alkalosis. 18, less than acidic, right? Now we have to ask ourselves, okay, where is this normal in terms of the pH? Is it closer to 7.35, so that's 7.34, or is it closer to the alkalosis side? It's closer to the acidic side. So we create our imaginary arrow, we take that, we circle 3, and here we got fully compensated, and we have metabolic acidosis. All right, that's it. Thank you so much for being here. I hope that this clarifies everything ABGs, and you can do well in your next exam or your next class. I want you to do as much examples as you can. Watch this video over and over and over again, and click that link in my description box to get the NCLEX review. It has all of this in detail, and it will help you with more examples and more review. All right, until next time, take care.